Welcome to another edition of Chew Chats, where plant-based eating takes the mic. Today we will be chatting with Dr. Jann Lawlor, where posture and balance are on the plate.
Okay, we have Dr. Jann Lawlor here with us today to help us learn more about balance and what we can do to enhance our balance. So Jann, what is it that we can do that's really important to stabilize us as we move through our daily routines?
Well, from a physical therapy perspective, we want to talk about standing tall. Mm-hmm. And we have this daily force called gravity pushing down on our body every day. And as we age, and even as infants, we have to work against that gravitational pull. What happens is if you don't resist it by standing tall, the bones in your back can change shape and actually pie shape here, mm-hmm. and you will start to, if you will, round like that. And then your body weight actually shifts forward, and then it makes you at a higher risk of falling. Okay, and also as we age, our bones can get brittle if we aren't eating right, and it's just can be a normal aging process. We're learning a little bit more from Chat and Chew on how to avoid that. But if that does occur, the bones actually change shape, and you can't work against that. So that's a little bit unfortunate when that happens. Mm-hmm. So we've seen the older patients change, and we call that the Dowager's Hump. Okay. So that's a big reason, because you just don't look or feel better if you're not standing tall. Mm-hmm. Mm-hmm. Your diaphragm gets compressed, you can't breathe, you can't sleep well at night.
Mm-hmm. And as you said, it pulls our balance off to begin with.
Yes, it actually brings you forward, and all the resistance comes right into your back, and it makes you really start to feel like you're going to fall forward. Yeah. Our head is our heaviest point in our spine. So if you just think of normal physics, you put the heaviest point here, it's going to rock forward. So the goal is, if you imagine a plumb line, the ear over your shoulder, shoulder over your hip, hip in line with your knee and ankle.
Okay, so talk to us about how we stand tall.
Okay, well, for the first thing in the morning is how we set our day. Okay, mm-hmm. You get up out of bed, and a lot of times going just from a line to sitting, your blood pressure changes, your heart rate mm-hmm. increases, and you can feel a little bit dizzy. So you want to sit there for about 10 to 15 seconds, and then take care of business, like if you have to go to the bathroom and such. But after you're set for the day, after the first 5 minutes, what I like to tell people is to go against a wall, okay? Because if you're slumped forward after sleeping a little Kabawaki or off, you're going to stay like that. But the minute you start standing against a wall and you feel the back of your head and the middle of your back and the bottom of your spine touching the wall, then you're going to be like, I can breathe better, I can stand better, even with your hands against the wall. If you try to flatten your back, that's a little bit too much. Mm-hmm. Your back has like a S curve or spring-like curve. So you want to have your head, you want a little space here, and then you have your middle back touching, and then a space here, and then the bottom of your spine touching. Okay? And so you can see my ear is in line with my shoulders in line with my hip, knee, and ankle. Mm-hmm. Also, you don't want your head to be up, because that angle is compressing up here and down. That's causing a lot of compression here. You want your chin to be level to the floor. You see? Yeah. So then after you've sat there for 2 to 3 minutes, then you get up and you'll feel your body in alignment from the beginning of your day.
And so we've got our body in alignment. Now we also can do other things though to help stabilize ourselves. So tell us what we can do to build that posture and that balance.
Well, we do know that at least one person in 4 over the age of 65 can fall because of weakness or visual deficit. So you kind of want to get to the reason why the balance is not so good. But from my perspective, and I'm a doctor of physical therapy, you want to strengthen your body and challenge your balance. One of the very first exercises I like to give people is trying to balance on one leg. We know that if you can't balance for at least 10 seconds, you're at a 90% risk of falling. 15 seconds, 75% risk. And if you can do 30, you're at a minimal to no risk of falling.
Okay.
So just that, after standing against the wall, is a good start. Challenge your balance. Some days you'll be better at it than others. You should, whenever you first start, you should be near a kitchen counter
Okay.
and try to practice it. Give yourself at least 3 tries,
Okay.
you know, and really focus on one space. It takes a while to learn to talk and walk and move while holding that stance.
Right.
But that's the very first exercise to try.
Okay.
But then there's a lot of things that can cause a balance deficit. It could be the medications you're taking. It could be a visual deficit. It can be muscular weakness. So you want to try to get to the bottom if you're having problems with balance, what might be causing that. But from a physical therapy perspective, my exercises would include ankle strengthening because that holds the foundation of your body. So you're going up on your toes, 1, 2, and then back on your heels, and then up on your toes 10 times. And then you want to march in place. Marching requires balance, shifting weight, you know, left to right. Little mini squats, 2 and up, and forward, backward walking, and sidestepping. So I have 6 total.
Okay.
So those are the 6. In physical therapy, we like to call balance our 6th sense. We have sight, hearing, smell, taste, touch, and then balance. And part of that is body awareness too.
Yes. Okay. We'll work on our 6 senses now.
Yes.
Great.
Thanks
Thanks a lot, Jann.
Thank you for coming.
Thanks.